Today in this presentation, we're going to be talking about anxiety disorders. Here's a table of contents, introduction to anxiety disorders, types of anxiety disorders, symptoms, causes and risk factors, effects on teens, and treatment options. Introduction to anxiety disorders. What is anxiety disorder? Anxiety disorder consists of a state of constant worry or tension due to a feeling of fear or uneasiness that, unlike stress, is prolonged a minimum of 6 months, depending on the type of anxiety and not one-time occurrence. Anxiety disorders are among the most common mental health concerns affecting millions of people worldwide in the U.S. alone. They around impact 1 in 5 adults each year. Fortunately, anxiety disorders are medication or lifestyle adjustments many individuals can effectively manage their symptoms and enjoy healthy, fulfilling lives. Types of anxiety disorders. What are the most common anxiety disorders? Generalized anxiety disorder, GAD, constant, excessive worry about everyday things. Panic disorder, sudden and repeated panic attacks, intense fear, physical symptoms like chest pain or dizziness. Social anxiety disorder, intense fear of social situations or being judged by others. Specific phobias, extreme fear of a particular object or situation, examples heights or spiders. Separation anxiety disorder, fear of being away from loved ones. Agoraphobia, fear of places or situations where escape might be difficult. What are the most rare anxiety disorders? Selective mutism. This disorder involves a consistent failure to speak in certain social situations despite in other settings. It usually begins before the age of 5 and can cause major challenges in school and social settings. Illness anxiety disorder. Hypochondriasis. This is an extremely rare form of anxiety affecting about 0.1% of people in the U.S. It involves excessive worry about having or developing a serious illness, or even when little or no medical evidence support this claim. Substance and medication-induced anxiety disorder. This rare anxiety disorder results directly from drug misuse, medication side effects, exposure to toxic substances, or withdrawal. The anxiety symptoms are primary and closely linked to the substance rather than a traditional physiological cause. The most dangerous one, panic disorder. Panic disorder is considered one of the most dangerous types of anxiety disorders, unlike other forms of anxiety. It involves sudden and intense panic attacks that may and can occur without warning. These attacks trigger overwhelming surges of fear that are very hard to control. The physical symptoms often mimic as a heart attack. Because of this, panic disorder can be especially distressing and disruptive to daily life. Symptoms. Most common symptoms of anxiety disorders. Here on the first row is the emotional symptoms: constant feelings of fear or dread, irritability or relentlessness, difficulty concentrating or racing thoughts, feeling overwhelmed or on edge, anticipating the worst outcomes. The physical symptoms are a rapid heartbeat or palpitations, shortness of breath, muscle tension or aches, fatigue or low energy, sweating or trembling, upset stomach, nausea or diarrhea, headaches or dizziness, sleep disturbances, trouble falling asleep. Causes and risk factors. What are some of the causes and risk factors of AD? Anxiety can develop from biological, physiological, and environmental factors. Common causes include genetics, family history of anxiety, or other mental health disorders can increase the risk. Brain chemistry imbalances the brain chemicals like serotonin and dopamine that help regulate mood and stress response. Personality traits. People who are more sensitive and perfectionists or shy may be more prone to anxiety. Part 2 is trauma or stress. Experiencing trauma, examples abuse, neglect, and accident or loss, or chronic stress can trigger anxiety disorders. Medical conditions, certain illnesses like heart problems or thyroid disorders, can cause anxiety-like symptoms. Substance or withdrawal, drugs, alcohol, or caffeine you withdraw from them can worsen anxiety. Environmental factors, difficult life circumstances such as financial problems or stressful home or work environment. Here's some risk factors. Certain risk factors can increase the likelihood of anxiety disorder. These include family history, having close relatives with anxiety or other health conditions, childhood trauma, abuse, neglect, or witnessing violence during childhood increases the risk, chronic stress, long-term exposure to stressful situations such as work pressure or financial difficulties, personality traits, being overly shy, sensitive, or perceptions may raise susceptibility. We already went over many, but other mental health conditions, depression and mental disorders can co-occur with anxiety, substance abuse, and medical illness, but also a lack of support system. Limited support, social support, or isolation can increase emotional vulnerability. The effect it has on teens. Anxiety can make it difficult for them to sleep or stay awake, leading to chronic fatigue. Poor sleep can also worsen the anxiety, creating a negative cycle. Many anxious teens become more irritable or angry, often snapping at family and friends. This irritability can harm relationships, increase social isolation. It could be family, friends, and also peers like teachers. It could be teachers too. Trouble concentrating. Anxiety frequently causes difficulty with concentration, making academic work much harder for teens. This can result in declining grades and a loss of confidence in their learning abilities. Physical complaints. Teens with often experience headaches, stomach aches, muscle tension, or explain physical symptoms. These complaints may persist even after medical causes are ruled out, reflecting their body's stress response. Withdrawal from social activities. Anxiety can cause teens to avoid stress and activities they previously enjoyed. The social withdrawal increases feelings of loneliness and depression. Excessive worry about overthinking. Teens with anxiety tend to obsessively worry about alcohol, social performance, or appearance, or even minor issues. This constant rumination drains their energy and affects their self-esteem. School abstinence. School avoidance. Some anxious teens may frequently refuse to attend school due to fears of stressors associated with the environment. This avoidance can destroy academic progress and social development. Low self-esteem. Anxiety can make teens feel overly self-conscious or afraid of criticism, leading to a diminished self-worth, or they may constantly seek reassurance or compare themselves negatively to peers. Substance use. To cope with this anxiety, some teenagers may turn to alcohol or drugs in search of a relief. Now, substances may temporarily ease these symptoms. They increase the risk of dependence and worsen anxiety long term. Risk of depression. Anxiety in teens frequently co-occurs with depression, and chronic anxiety can increase the risk of developing depressive symptoms. This combination makes mood disturbances more severe and challenging to treat. But here are some treatment options. Treatment options are cognitive behavioral therapy, CBT, the most effective form of therapy for anxiety. It helps identify the negative thought and patterns and behaviors. There is exposure therapy, which gradually shows the individual's situations that may induce fear, but over time should reduce the sensitivity to it. Talk therapy. provides talk therapy, psychotherapy, provides emotional support and coping strategies. Part 2, medication, antidepressants such as SSRIs, fluoxetine, sertraline, and SNRIs. Anti-anxiety medications like benzo use short-term due to a risk of dependence. And beta blockers help manage physical symptoms like a rapid heart rate. Some lifestyle changes would be a regular physical activity, healthy, balanced diet, adequate sleep, limiting caffeine and alcohol, mindfulness, meditation, or deep breathing exercises. And support groups. Part 4, support groups sharing experiences with others facing similar challenges can reduce isolation and offer encouragement. Stress management techniques, journaling, time management, relaxing techniques, example like yoga and progressive muscle relaxation. Treatment plans are often personalized and may combine several approaches. It's important to consult a healthcare professional or proper diagnosis and guidance. But in my opinion, in this right here, I think one of the best ones would probably be journaling and time management, because time management usually is like do the work, and when you're overcrowded with work, you have no time management. So much stuff is going on, which can lead to stress and anxiety. So if you have time management, you can control that. You know what to do, when you would do it, and everything is set and clear, so you won't have to stress on knowing if you have to overlay or put your work over top of something else. And journaling, having a journal definitely helps. Writing it down and just like, putting it in a diary or whatever, so we can make a story. Just writing it down definitely helps. But in summary, although anxiety disorders can be challenging, they are manageable. With the right treatment and support, many individuals are able to reduce their symptoms and live healthy, fulfilling lives through a combination of therapy, medication, and self-care strategies. Seeking help early is effective to recovery. Thanks. Credits. These are credits right here.